My name is Dr. Abigail Noel, and I am the head of department at the Accident and Emergency Department, also known as Casualty. As head of department, I am responsible for coordination, and I'm also responsible for training of staff. Training of staff is to enhance our staff, not just in the medical, but also in personal well-being. We have been working along with Mount Sinai since November, and in that time, we have had such a great experience with the Mount Sinai team. One thing I love about Mount Sinai is their spirit of collaboration. They came in with ideas that we were able to discuss, and we were able to implement them. There are so many processes that they have implemented here, especially in the emergency department, that have transformed our department in real time. One of the things that I would mention is the implementation of ID bands for every patient that comes through the emergency department. So once you get in here, once you're triaged by the triage nurse at the front, you receive an identification band. And as we can imagine, that has decreased patient errors, have decreased errors in identification of patients. Because here in the emergency department, not everyone comes in able to talk or able to give information. So having an identification band on each patient has really helped us improve patient care and decrease errors. Another process that they have implemented is defibrillators on every ward, including the emergency department. Defibrillators basically are those machines that you would see on TV where they shock people. We have those on every ward. We have also started training staff in how to adequately utilize these machines. Thus far, 128 staff members have been trained in defibrillator use, and this includes Grenada and Carrico. Mount Sinai has implemented a huddle system. It is a system that I have had experience in because I had experience working with Mount Sinai in Guyana. The huddle system is basically a small meeting, like a 15-minute meeting with all team members. And when I say all team members, I mean security guards, receptionists, maids, nurses, doctors, everyone who is on duty in the department at the time, drivers, very important. They come in for a mini 15-minute check-in where we discuss any issues to patient flow from their prior shift, and also not just issues, but also compliments, great things that happened on the shift. One of the advantages of huddle that I have seen in our department is that it improves communication between staff members as well as with patients. And also staff members have a sense of confidence. They feel seen, they feel heard, and they understand that their role is important. This transformation means everything to the emergency department and by extension, the health system. They are giving us the tools and the knowledge so that we can accelerate, that we can fix our problems, and then the systemic issues, they would be resolved over time. But we are resolving our issues internally, and I've seen a great improvement, especially in the emergency department, and I expect that we are going to improve even more, and I'm very excited about that.